The College of Nursing started out as a department back in the mid-50s. The starting was driven by community need. So the first graduates in the undergraduate program were in the late 50s, and since that time, there's been about 5,000 undergraduate nursing graduates in this area since that time. Our outcomes for all of our programs are very strong, above 95% pass rates, and they have been that way for years. It's not a new thing, it's not something that fluctuates. Hospitals who have a higher number of nurses prepared with a BSN have better outcomes for their patients. Their patients are less likely to be readmitted. They're less likely to have complications. If they do have a complication, the nurse is going to be able to recognize them quicker. And so it's a benefit to hospitals to hire higher proportions of bachelor's prepared nurses when you consider patient outcomes. Simulation has probably changed nursing education more in my lifetime than I don't even know what. What it allows us to do as teachers is put a student or a group of students into a setting where they can work through a patient scenario. And what that does is allow those students to practice the actions and the decision making that they would do in an actual clinical setting. The idea for simulation is students can practice high risk, high volume things in a safe setting. They can go and debrief after and say what worked, what didn't work. They can come back and try it again. They can practice teamwork and they can practice communication. And we know that failures in teamwork and failures in communication can be a very significant problem in healthcare settings. Simulation will never replace going into a clinical setting and performing care. And so there's ways that we facilitate that as well. So for example, one of the strengths in the undergraduate program is each undergraduate nursing student spends 6 weeks with a preceptor. What is so incredible about that is that has been a part of our curriculum since at least the early 90s. And nurses in this community have volunteered because it's a volunteer role to be a preceptor. And it's a wonderful example of McNeese graduates giving back to the community and giving back to McNeese. In order to prepare the healthcare providers that this community needs, there has to be a strong relationship between educational institutions that prepare those providers and clinical agencies that also help in preparing them, but in also hiring them. For us here at McNeese, we could never be successful at producing the healthcare workers that are needed for Southwest Louisiana if we didn't have support of a Memorial healthcare system. Their partnership with us elevates the care that our graduates provide to the people of Southwest Louisiana.
Day one for a new nursing student is filled with a lot of anxiety and sometimes fear. They often haven't had those kind of experiences, and it's pretty intimidating. By the end of their clinical learning, they're ready to finish and go to work. They're excited about the next steps, and you watch them progress in their confidence more than anything. You know, as you finish a nursing program, you're beginning the profession at the base level. The nursing school does a very good job of providing to our health system, our community, our region, but they're just beginning. It's our job to then pick up where they leave off and continue that development and support of that nurse as they travel down what we call the pathway from novice to expert. Without the partnerships with the schools of nursing or any of the healthcare educational programs in our region, we wouldn't have the workforce needed to take care of the community. Memorial is the region's transfer center. We're the largest healthcare facility. We consider ourselves the place that takes the patients that can't be handled in the rural hospitals and other areas. And it's our duty to make certain that we're providing learning opportunities for all of the students. We need them. The community needs them. First semester is what we call foundations or basic nursing, personal care of patients, physical assessments, documentation elements, those kinds of things. Now their final semester, they have a registered nurse preceptor that they work with several shifts a week, and they work side by side with that nurse for that whole semester. Often they've tried to direct towards the area that they have the greatest interest in when they graduate. That helps in that transition between school and coming into the real world of working as a registered nurse. Culture drives that experience for anyone in the healthcare system, definitely for our students. Often in some organizations, students can be viewed by nurses in particular. Nurses are very busy and have pretty heavy workloads. In that capacity, sometimes taking on a student or slowing down to meet the needs of the student's learning can be viewed as an additional challenge for a nurse. We've worked diligently with our team to support our team so that they have the capacity to be able to work with students in an accepting and facilitating manner. That yields a better clinical experience for the nursing student. I'd say it also yields a better clinical experience for the nurse as well. They're our future. We need to take care of them and help them grow and learn.